I didn't even enter the labor ward. The baby fell. He came, but he was dead. He was a big boy, but he was dead.
So no labor pain,
no labor.
nothing.
I've given birth more than 5 times, but I've never experienced labor pain in my life. We agreed that I should not even think of conceiving. It's a risk. It's a risk of my life. So I said, I'll just move on with my ministry. I thought I didn't need a baby at that juncture because it was too much.
Okay.
Doctors were like, please don't even try it again. And I said, I'm not the one who is trying. They come. I don't know. I was not the one who was trying.
Hello, my friends. This day is a day that we look back and talk about the blood groups. You remember Dr. Mbuga was here some time back, and she talked about the incompatibility of different blood groups, and especially when it comes to mothers who are giving birth. And she took us through the different blood groups, and she said one thing, that no blood group is better than the other. It's just the way God formed us, created us, and we were able to start moving in life with those blood groups. However, there are some that do not rhyme in terms of when mothers are expectant. If they are not known early, then they bring some miscarriages or sometimes losses of those children. And to take us through this is one who has been able to go through such kind of issues, and she's here to share her testimony of how she has moved from losses to being a mother today. And without much ado, I always say that Health Now Show is your health friend in all matters health that will really help you to live quality lives in your life. And when I bring a guest, I'm bringing a guest because I know they will touch lives. They will encourage you, you who is there, so discouraged. And that is why we have Esther Muthoni John. She's going to introduce herself further, and then we move on. Karibuni sana.
Thank you. Thank you, Sister Jane, for that introduction. My name is Esther Muthoni John. Before I was Esther John, I was Ubenda Abdallah, but I'm known as Esther John. That is my registered name, and it's the name that I go by. I am born again, and I am a woman of God and a woman of faith, daring faith. The faith is the smallest faith, but again, it moves mountain. And I'm sharing my journey of motherhood. It's not been a walk in the park. It's not been a bed of roses. But again, you know, roses have thorns. So yes, it's roses and with thorns. But I admire my walk with the Lord.
So thank you, Esther, for that introduction and being a mother. And you've said that it's not been a walk in the park.
Yes.
I know mothers, most of the time, we create with God. Yes. That's what I believe. And we are talking about the blood groups, the Rhesus factor effect. And for you, it is a testimony, it's a journey that you are going to share with us. Where did it all start?
It started at the beginning.
Yes.
Because I didn't know it was that way until I got married. Because I gave my life to the Lord when I was a very young girl.
Yes.
At the age of 13.
Yes.
And I left the godly life of a born-again Christian girl on my high school days, and until I got a boyfriend when I was in college. And I didn't even go into boyfriend-girlfriend issues. I continued with my life and ministry.
Yes.
Because I was very busy in ministry. I was trying to bring our family to the Lord, and there was so much on the table for me that I hardly had no time
Yes.
for him
Yes.
as a boyfriend. So until when we got married, and I conceived immediately. And now when I conceived, trouble began. I didn't know, being my first conception, I didn't know what was going on. But until when I was like 6-7 months, the baby, I realized the baby was not playing. And I felt like there was a shot, like I was shot inside. And I felt like the baby was shot. And I...
Like the way you shoot
Yeah.
with a gun?
Yeah. Because I could tell the baby fell in my womb. He fell, was a he.
Okay.
Because he was born normal. He was born, though a stillbirth now. So I told the father, I have felt like I was shot. The baby was shot. And it was like, how would he be shot, or she?
And by who?
In the womb.
And by who?
And I said, and after like 10 minutes, he was not playing, he was no longer moving, and all the kicks I was enjoying, I could not, there was nothing. And I started feeling like I was not breathing. I started going short of breath, and I started feeling some funny pain. And I started now searching for him. I didn't know that he was also struggling, or the body was struggling with him. And because I previously had no issues, I had started my antenatal clinics, and there were no issues at all, not even blood. I was okay. I was not on anything. Okay, I was on intervention, the Rhesus for blood strengthening, but it's not because I had less blood. I was okay. So by evening, because I realized that around 11 a.m. and by 5, I was already very sick. I started feeling like I want to diarrhea. I started experiencing some funny, I was in pain. Then, but being a prayerful woman, I've lived all my life in prayer. So I continued in prayer. I didn't even ask anyone. We were living alone. We were somewhere, we had rented a house where we were living alone. So I didn't even realize, I didn't even ask anyone. I thought that's how people experience.
Pregnant mothers experience,
yes. Yeah, because now I was in the 3rd trimester. So I knew it will not be, of course, we had a chat with the nurses, and they were telling us that sometimes it's not comfortable. So I just thought it's the beginning of the uncomfortability, and it's just started. So I was ready for it. And by night I was very sick. So in the morning my husband called our pastor, and he said Esther is very sick, and she was unwell the whole night. And so when pastor came, they prayed, and after prayer, he said we needed to go to hospital, and the pastor drove to hospital himself. We went to Chuka General Hospital. It was the biggest hospital then,
yes,
near where we were ministering,
yes,
because we are pastors.
Yes.
So we went to Chuka General Hospital, and when we went to Chuka General Hospital, immediately the nurses knew all was not well. And I was admitted immediately. And they talked to me. They said, we need a senior gyne. And they said, by the time I was getting to hospital, actually it had advanced so much, because by then my BP had shot, because the baby had died and was in the womb. Now this was the 2nd day in the womb, a dead body. So they told me I've lost the baby, and the BP was very high. It was coming to around 200, 210 over 110, and that was very high. So I could not be put into an ambulance, because I think back then doctors and more passion and calling, because this doctor, allow me to mention his name. His name is Dr. Okolo. He said, if we put this lady in an ambulance, according to the test that had been run, my heart could not go beyond 45 minutes from 30 minutes. So the doctor advised that he was going to talk passionately to his colleague at the PGH, so that the colleague would be the one being brought by the ambulance, as opposed to me being taken by the ambulance, because I ran a risk of bursting the veins. So I was the doctor came, and by the time the doctor was coming, from the short discussion, I knew all was not well. So I crawled, as the doctor was waiting for his colleague, I crawled into the nurse's duty room, and I went under the bed. And just before I could switch off, I prayed. I told God, I said, God, I don't even have strength to pray, but I've come to ask you to not to terminate my life at this point, because what is happening is not my doing. It's not what I would have wished. And I said, I have so many projects about the youths and mothers in this world that I don't want my life to end now, because you have invested so much in me, in bringing me to where I am. So I said, Lord, what I ask now is because I know you are going to heal me, and they are saying I'm hypertensive. Now, what I ask of you is that please give me another lease of life, renew my lease, and as you do it, as I wait for papers to be signed in the heavenly realm, Lord, I ask that you give me peace. The peace that you gave Peter when he was about to be beheaded and he was about to die. And you gave him peace. He slept until when an angel woke him up, he sleepwalked for a kilometer in his sleep. It shows he had peace. So I said, Lord, give me that peace so that I stop feeling the pain as I wait for you to renew my lease. And I didn't even say amen. I just blacked out and I slept. And when I was there, I'll share another dream that I saw later. But the Lord renewed my life, the lease of my life.
Yes.
And when the doctor arrived, they were looking for me now everywhere. I was under the bed and nobody would think that I even had the strength to move to that place. And when I was found, they were shocked to find me alive, because they thought I was in a dream. And when I woke up from that dream, when I asked the Lord from the dream, where do I pass to go back to the hospital where I was, because I was taken to another hospital. And
in your mind?
In a
dream.
I dreamt. I saw like nurses. Those days, back in early 2000, the nurses used to wear white dresses.
Yes.
So I saw like 2 nurses came and picked me, and I was carried, and I was taken to another hospital. And so when I went to another hospital, I found a gentleman, and we were separated by a crystal wall. But the doctor could enter his hand and take my measurements and tests. And so I explained, I said, Doctor, I've come because I was in another hospital, and in that hospital they said I'm hypertensive, that I was not supposed to get pregnant. I was not supposed to conceive because I was hypertensive. So I explained my story, and I said, and so the doctor took my blood pressure, and he said it is 210. I said, that's what they said from the other hospital I was in. And he gave me a tablet, as a very tiny tablet, no, a capsules first, and I swallowed. And I swallowed, he started taking notes of my life. And I narrated my life, how I had walked, how I was born in this family, and how we've worked with my mom.
Now that is not in a dream. You are
It's
talking.
in a dream. I'm
You're
talking to
still in
this
the
doctor in a dream.
Okay.
So after he said 30 minutes are over, so he took my test again, and the BP was 190. And he said it's coming down. And I was happy it was coming down. So he continued taking notes. And he gave me another tiny tablet that was tinier than a Piriton. And I took it. And when I took it, he said the baby will come out. I will not be operated. And the baby will come out. Though I've lost him, I'm going to be healed of the hypertension, that I will not live on hypertension drugs. That is, I'm going to be healed. And I was shocked, but I was happy. So I said, now I need to go and share this with my husband and with other people that I've left in the hospital. It's in a dream. So he said, it's okay. And I asked where I was going to, how do I get to the hospital? And there was a curtain. I saw a curtain near, and he said, lift that curtain. So when I lifted the curtain, I woke up. So when I woke up, the nurses had now found where I was, and they were not sure whether I'm alive or I'm dead. And so when I woke up, I saw the nurses, and I thought it is the angels who have come to take me to the Lord. And I screamed, shout the victory of Jesus Christ. And one nurse said, oh, she's alive. And I wondered who was alive. So they explained, the doctor came, this senior doctor came, we've been looking for you all over, we didn't know where you went. And I said I was here, and we walked out, we stood, and they helped me to the doctor's room. When the doctor saw me, he knew what was happening. And they took my BP, it was 215. I said I was in another hospital. When you were looking for me, I went, and they thought my brain was going nuts because of the BP. And so he said, your brain is not okay because of the BP. And I knew, no, I was okay. So I said I was in another hospital, and that doctor took test, and he said, at first it was 215, then it came to a 90 and 160. And this doctor said I will be well. So he had carried some tablets, and he gave me, and I swallowed. I was hardly audible as I was talking to him. So I swallowed, and he was like, do you always speak like that? I can't hear what you're saying. And I told him, now he was with Dr. Okolo, the senior MOH. And I said, no, I speak very loudly. I am a praise and worship leader. I preach. I don't know where my voice is. And he said, it's because you're very sick. And he explained the scenarios, the possible scenarios. And they were not very pleasing. They were ugly scenarios as he was unfolding them. But I remembered I had seen another doctor. And I remember I had prayed before I went to the other hospital.
Yes.
So I said the prayer, I said, as long as I've prayed, I leave it to the Lord. I will not worry about it. And so after that 10 minutes, as we were talking, and he was taking my life history, he was taking the history of our family, he was taking some notes. He asked the nurse again to take my blood pressure, and it had come to 190. So it was now being under control.
Yes.
And I was again happy because that's what I had seen in the other hospital. And I was given a very small tablet that I swallowed. And the doctor went back to the MOH room to wait for what would unfold, because nobody knew what was going to happen. Of course, with that BP, I could not go through a CS, and I had lost the baby, so they discussed there was no way. It was pointless unless it's the last option. It was pointless to take me through an operation. I get that scar, and I've lost the baby. So I was allowed to, they left me for a few minutes so that as they monitor the BP. And immediately he went back to the room. Even within less than 10 minutes, I felt I needed to take some sonda. And I went to buy a sonda.
You had the strength to move?
Yes,
Yes.
I had strength to move.
Yes.
So when I went, as I was coming with my sonda, I felt like my limb was disjoined. And I limped, and the nurses ran to pick me. I didn't even enter the labor ward. The baby fell. He came, but he was dead. He was a big boy, but he was dead.
So no labor pain,
no labor.
nothing.
I've given birth more than 5 times, but I've never experienced labor pain in my life. I don't. There is a way that the Lord does it for me. So I've you know, when they saw me limp, they knew. I think they've been at it long. So they just picked me, and they told me to rush to the labor room, but I couldn't reach. The boy just fell. I felt like I wanted to sneeze, and I sneezed him out.
Okay. We can laugh now, Esther.
Yeah,
we can laugh.
Today
We
I
can
talk about it, and
we
I
can
laugh.
Yeah, because it's not really a
because
laughing
the Lord
matter.
has healed me.
Yes.
I have scars, but I love them.
Mhm.
I love them.
Yes.
Because it's from these scars that we are able to minister to families.
Yes.
It's from these scars that they are able to believe that it's possible, that there is a God in heaven
Yes.
who does wonders.
True.
It is from these scars that someone is able to know that I have tomorrow. I can sleep in tears, but tomorrow I woke up smiling.
Yes.
Yeah, I love
Joy
those
comes
scars.
in the morning.
Yeah, joy comes in the morning.
Yes.
Because when you're going through it, sometimes you look back and you wonder, how did I even go through this?
Yes.
Because now when the boy came, now the nurses talked, and they said we had explained, and you knew it would be like this. We are so sorry. And so now the doctors came to confirm that it was a normal birth. It was a normal delivery, and that it has happened so fast. But I was put on hypertension drugs immediately. But I knew, because I knew that I was not in a dream. it was the Lord who took me to his a facility. So I knew I was going to be discharged from the drugs, from the hypertension drugs.
Yes.
And so the doctors talked to me, and they were like, after carrying several tests and after several reviews, we agreed that I should not even think of conceiving. It's a risk. It's a risk of my life. So I said, I'll just move on with my ministry. I thought I didn't need a baby at that juncture because it was too much.
Okay.
But I didn't know. Actually, I conceived immediately. I didn't after. I think after about 2 months. But I didn't know that I had conceived.
Because the doctors told you not to conceive, but you conceived.
Yeah, I didn't know I had conceived.
Yes.
So when I suspected, I was waiting for healing. So when I suspected I was expectant, I again went to the same facility. Now this time I decided I'm going to start my ANC in a bigger in the big facility.
Yes.
So I started immediately, and I started going for clinics. And when they at first they didn't think it was a baby, but after a lab test we confirmed, and I started my clinics immediately. So after the clinics, of course I was to continue with the drugs, but then I thought I wasn't going to mix my baby with the drugs, and the BP had been controlled.
Yes.
So I was now put on the intervention drugs for ANC mothers, the calcium, the blood, the vessels, all that intervention plan.
Yes.
I continued, and again I didn't reach my EDD. At some point when I was about 7 months, I felt I realized that I thought the BP was rising again. And I went for checkup. And when I went for checkup, the nurses, they looked at my file and they said, you know you are a case of the senior doctors, and let's call him. So they admitted me to wait for the doctor. And as I was waiting for the doctor, he didn't even come. Again, the baby was delivered. But a very fine baby, very healthy boy. He was 3.85 at 7 months. And when the doctor came, he thought I was now suffering from gestational blood sugar, gestational diabetes.
Yeah.
And all tests confirmed negative, and the boy was negative. And to date, I've never tested positive of any sugars. But they couldn't imagine a 7-month boy at that weight. So we were discharged the following day, and we went home. And the boy grew, was cordially well. He grew up like a normal boy. By then I had gotten a job at the cooperative bank. I was working at the Kerogoya branch. I was working also for Celtel Kenya. So he grew normally past 1 year birthday, and after 1 year, when he was 10 months, he was diagnosed positive for pneumonia. But I'm the one who went to hospital because he was not coughing, but he was like breathing abnormally, and he was turning colors, and I thought I didn't like the colors I was seeing, so I went to hospital. And the doctor said he had pneumonia, and we were admitted. And after a week, we were discharged. But by the time we were getting discharged, he had now started coughing, and he had started some homa. And we were discharged. And after a week, he was down again with the same pneumonia, and we went to hospital. We were admitted. They were running some tests on him, but I think they had discovered some symptoms of trouble. But because they thought now in the district we could not get the money to go to a bigger facility or to pursue it further, so they kept. But I still remember in my head the way they were saying this central cyanosis. This is some ones they were using medical terms.
Yes.
That when I flash back after I realized what was happening, I know now what I know is what was causing that trouble.
Okay.
And we lost him after 4 days in hospital. We just lost the boy on 27th of October 2004. We lost him. He was buried on 27th of November 2005. no, 2005, sorry. And by the time I was getting married, I didn't know that I was expectant again. Because, yes, with now the third pregnancy, my daughter who is now in Form 3, because I was still receiving my periods, so I didn't know I was expecting. So we buried the boy, and now I was in stress, and because now the doctors were like, please don't even try it again. And I said, I'm not the one who is trying. They come, I don't know. I was not the one who was trying. I said, please don't
just
try it
allow
again.
us to laugh because, yes, because you were saying you are having your periods.
Yes.
You're still having your periods.
Yes, I was having my periods normally.
And you are expectant.
Yes.
And you've been told not to become.
Yes.
And then they're asking you, why are you becoming pregnant?
Yes.
And
but I was not trying. I had not even tried to get pregnant. It had not even bothered me that I was not to get pregnant. And by the time I was losing this boy, I was now pregnant. But I didn't know. To date, I've never known. Even the ultrasound could not tell when I conceived.
Okay.
Because we buried him on 2nd of November. And on 19th of December, I fell sick. That's now when I realized I was pregnant. I fell sick. I felt like I was in, like I was, it's my ribs. I felt like there was sharp pain coming from the ribs.
Yes.
And I could not even walk. It's like I had a stomach ache, but I didn't even know which stomach was aching. As the doctors were asking, which stomach? And it's then I realized, it's now I realized I had 2 stomachs. Previously, I had not known I had 2 stomachs. Until when I was admitted at Chagoria Hospital.
Yes.
On 19th of December in 2005.
Yes.
And when I went and I was bent because I could not walk because I had a stomach ache. So the doctors were like, which stomach was aching? And I was like, how many stomachs do I have? Am I a cow that I have 4 stomachs? The doctor... So the doctor was like, point out where you're feeling the pain. So I said, the lower abdomen. And he said, you have 2 stomachs. Then he taught me that I had 2 stomachs.
Yes.
Today I know I have 2 stomachs.
Yes.
And I know women have 2 stomachs.
Yes.
That's why we are women.
Yes.
Because we are a man with the womb. So I knew that our name is derived from what we carry, the second stomach.
Yes, the second stomach. Yes.
So, and the test.
So now they have realized that you are expectant the 3rd one.
That's now when the tests were done.
Yeah.
To show, to reveal what was wrong with the stomach that was aching.
Yes.
I was admitted, and the test showed that I was expectant. But they called it spotting, because I was even in my pants. I said, you are spotting and you are expectant. And the tests revealed that I was about 5 months, but the baby had developed differently. Some parts had formed 3 months, and some other parts had formed 4 months, and I was at 5 months. And it was a complicated scenario. Again, I experienced it with my last baby, as you have some papers to show. So the doctor thought that I was admitted because now there was no cardiac activities, as the ultrasound revealed. There were no cardiac activities
for the baby.
In the baby, yeah.
Okay.
So it's again, I was losing the baby. Luckily, there was a case of anthrax. There was a suspected case of anthrax stones in the hospital. So there was a doctor. By then, Honorable Mudiawori was the Minister for Home Affairs.
Yes.
I know such cases, they were reaching his desk. So a doctor was being expected in the hospital from Nairobi. And a guy came along with him. And I remember, I think they were putting more pressure, some pressure on the baby, like they would put pressure on a vehicle wheel. And by midnight, the baby had started to react. I was on some drugs, and I was discharged the following morning on 20th of December in 2005. Because they realized that the waking of the baby was not their doing. Actually, I was not charged anything. For the first time, I was not charged anything. Even what we had paid at admission was refunded.
And they said that probably they want to monitor.
I was, nobody knew. I cannot explain what was happening.
Yeah.
But we were refunding the money. We were told to go home. and I was advised to start my ANCs. But when I went for ANC at the district facility, they thought it was gallbladder stones. It was not, it was a complicated scenario. But I continued in prayer. I've always been a prayerful woman. I've always been praying because my life has been full of battles. The battles I admire today, and I look back and I think they've made me who I am today. So I started my ANCs in January now 2006, and I went for I think I went for 2 clinics, and because there was no encouraging information that was coming from the hospital, I decided I would not go for the clinics again. I refused to go. I said I will stay in the house and let me see what will happen. I said, after all, I've done a good job. I've lived for the Lord. So I had nothing to lose if I died. And I said, if the Lord wants to take me home, he can take me home. At least I've enjoyed life. At least I've walked with him. And I was happy with what was happening between me and the Lord. So I said, if you want to take me home, he can take me home if he feels I've served him enough. But I gave him a list of the things I would want to do for the youth and for women. I'm passionate about the youth and women. And I said, I would like to touch Africa. And in my previous prayer, when in that hospital, he asked me what I wanted to do. And I said, there is so much I wanted to do. And I said, Lord, if you heal me, one of the things I will do is to give a testimony. And I will record this testimony for the family of believers to be encouraged and to know that you are real. Because we walk with you by faith. But from this testimony, I said, Lord, I have never seen a person or a woman you have healed of hypertension or you have healed of infertility, as they were calling it. But I said, if you do it for me, I will tell this testimony to the family of believers and many people that I'll come across. I will tell this story wherever I go. And so again now, when I was waiting for this baby, I said, if the Lord wants to take me home, he will take me home, but I will not have told the story everywhere I go because he will tell me. And I prayed with the Psalms chapter 6. I said, if you want to take me home, I'm okay. I was not going to attend those clinics again. And true to that, I never attended those clinics again. I continued serving. I was ministering in church. And I continued to serve until one Sunday morning, after morning devotion in church, I thought my hypertension was again misbehaving. So I said, let me go to a healthy facility. I called my auntie. There was an auntie living nearby, and she was also a member of our church. So I called her. I said, let's leave people after praise and worship. I said, let's go to the hospital. I would like to have my BP checked. And we went to the hospital. And when we went to the hospital, the nurses thought they felt it was not a BP issue. I was admitted for delivery. They thought I was due. I was 2 weeks shy of the date. So, and on doing the VE, it's true, I had opened up 6-7 centimeters. So I was admitted. But we don't know what again happened. After 2 hours, it was closed again. The birth canal had closed. So they didn't know what was happening, and I decided I'm going to involve my parents. But I didn't want to go through so much information. I said I didn't want to get discouraging information. So I left. I went to town. And I called my...
You left the hospital?
Yes, I left the hospital. I left my things there and I went. And nobody expected that I would even get to town, because they said, the uchungu itamrudisha. But the uchungu never came, and I went to look for my mother so that we could pray. I went to look for my mother, and we prayed. And as we prayed, she said, let's go back. Let's go back.
To the hospital.
To the hospital. And I said, I don't have any pain. And they said that they are closed. And it's not even, I said, I don't want to get to hear those discouraging reports again. She said, no, let's go. Let's have this testimony documented. Let's have it written by the doctors, because it's going to encourage someone else. And let's also go and get your bag. If not for delivery, at least you get your bag the right way. So you went back to hospital.
The wisdom of a mother.
So you went back to hospital. so that I could get my bag and have the testimony documented. I love testimonies.
Mm-hmm. It's
So
true. They help other people.
Yeah.
Yes.
So we went back to hospital.
Mm-hmm.
And we went back. When we went back, I was readmitted. They didn't even realize I had, they didn't even realize I was out for many hours. So I was readmitted, and I delivered after 2 hours, I had already delivered a bouncing baby girl. She's called Joy. We thought that the Lord has restored our joy and the joy of salvation.
Mm-hmm.
So we called her Joy. She was 3.55. She was a very big girl.
Big baby. Hey.
Very big baby.
Yes.
So my baby was delivered.
Mm-hmm.
She was 3.5.
Yes.
3.55.
Mm-hmm.
And it was on 24th of April 2006.
Yes.
And we were discharged the following day because there were no complications, there was no nothing.
Yes.
So on a Monday we left the hospital, and I went, and it was the first time I fasted after delivery instead of feeding, because I said, Lord, I want this girl to grow, because me and you, people are going to laugh at us. There is no way I will be telling people about you and encouraging people, but on deaths. I said, Lord, I want this baby to grow, and I prayed. I made a prayer, and I asked the Lord that if he thought it is the environment or what was it, that he should reveal it, that he should even change the environment for us. And as I was leaving the hospital, I didn't know that I had admired to work in government, because after the death of my son, I resigned. I never went back to the bank. I just never went back to work. I think I was in a state of depression. But I continued to encourage myself in the Lord, my God. When the loss is too big, it's always good to encourage yourself in the Lord, your God, in what you know as God. A superior superpower, a superior supernatural power. So I encouraged myself. But I prayed, I said, Lord, I would like to bring up this baby in you, but working in government. And I prayed for a job. And I fasted for 3 days. Of course, I was taking some drinks and breastfeeding the baby. Actually, I fed the baby within 2 weeks because I needed time to pray, and I could not pray as she breastfeeds. So exclusively, I didn't breastfeed her exclusively. I fed her on fruits. I started with the pawpaws, so that I could have
a baby.
Yes.
Of
I fed her within 2 weeks, because now the government had advertised for jobs in 2006, and the deadline was May 12th, and I had delivered on a 20-something, and I wanted to apply for this job, and I did. Actually, I left the baby in the house, and I went to town to apply for my job. I applied on the last day, and in October 2006, the names were printed. I'm one of those people who are employed by the Kibaki government, free and fair selection, without bribing anyone, without knowing anyone, that I applied for my job. I posted by post office, and I was shortlisted. Our names were printed in a print media, in a daily newspaper, in Standard. And my interview, we were thousands. And my interview was coming in October. No, interview started in October, and between October and December we were doing interviews, and the first lot was taken. Again, our names were printed in the newspaper, and the list was to be continued. That newspaper was saying the list to be continued, and as I continued praying, the baby was on a dove pneumonia, and she was also turning the blues, and I didn't like those colors, but I continued to pray and believe the Lord. And I continued cooperating with the doctors. We were on a Dove hospital, but she was very sick. And I remember at some point the doctors were almost losing hope on us. And I was with her. She was weak and vomiting, and I decided to close the church. And we closed the church, and I felt like I blocked. A time comes and you can't take it any longer. So I felt like I had blocked. I took my Bible and I sealed it. I didn't want to read it again. I was a fan of one of the radio preachers called Wangojiri. I said I dismantled my radio. I didn't want to listen to her again. I didn't want anything, and I just closed the church. We left church on a Sunday, and on Tuesday, I went around telling our worshippers, our members, that we were closing, that we will not be on again. And I sold what I could sell, and they said, let me lose everything, and the baby will be the last. And so I prayed. I said, Lord, if you're alive somewhere, you will come to my rescue, because you realize how much I love you. But it's like I'm forcing myself to you. I felt I was forcing myself to him. But I said, Lord, I have never even forced myself to a man, leave alone to you. And I prayed. I pleaded with him. I said, Lord, if you're alive somewhere, because I feel like I'm praying to a God that is not alive somewhere, that he exists in me. If you're alive somewhere, please speak to me. Please come in person, and let's have a conversation, and let's chat way forward, because I love you so much. And I said, Lord, I would hate to be a disgrace. I would hate to be a laughing stock because of you, but I love you so much. So I want to close this church, and I want to disconnect and unplug from everybody and from everything, and remain with you. So if I'm going, I will go clinging unto you, because I can't imagine of an alternative. I said I was going to cling to him, and I prayed. And as I was praying, I dreamt. I saw the president, Kibaki, came. He was youthful and handsome and tall. I could tell this is Kibaki, but a more youthful and energetic Kibaki, and he looked different and glorious. And when he came to me in a dream, I fell down. I said, oh, Mr. President, how can you come to look for me? Why have you come? And he said, I've come in person because I want to look, I wanted us to talk. And I said, Mr. President, you are the king of this land. You didn't have to come. You should have called me. And he said, Esther, if I called you, I said, you even know my name? And he said, yes. I call you Esther. I know your name, Esther. And I came because if I called you, you would not. It's now in a dream. If I called you, you would not have answered. I said, you would have written. I take time to read. I'm a good reader. And he said, you would not have read. I had dismantled my phone. I had removed my phone. I had removed the battery and just disconnected. So he said, you would not have answered the phone and you would not have read. I said, no, I am not that hardcore. I am not that kichwa ngumu. I'm not that hardened. You are the president. You are the king. I would have taken time. I would have listened. He said, I have come personally. So I asked him, why? Who do you think I am? What do you call me? Because you don't just call me Esther. Who do you call me? And he wrote somewhere, he wrote the word beloved. I said, no, I cannot be beloved of the president. Niko na mashida mingi. I have so many problems to be loved by the president, by the king of the land. That's what I was referring him to. By the king of the land. You are the head of all this. So I cannot, and I said, all my friends, they call me Sonny. So if you love me and you are such a friend, just call me Sonny. You cannot even call me, and I would delete the word beloved and write the word Sonny. My name is Muthoni. Yeah. So I write Sonny, and you delete it and write beloved. But when I delete beloved, it would still remain imprinted. So at some point I gave up and I let it remain. And I agreed. So we moved on, and I asked now, okay, I agree. Now that you love me, I'm your beloved. What is it? Bring it on the table. And he said, I've come to give you a job, and I'm giving you an administrative job. You'll be placed in Nairobi, and I want you to wake up and stand up, pick your baby, and start preparing. And I said, my baby is very sick. We cannot even afford to take her to hospital, and the doctors don't even want to see us again. So I'm waiting for her to die. But now, you'd rather not give me a job, but let the baby live so that we can preach with her. I'm passionate about her worshiping the Lord in church. So, and I said, but I need a job. I need this job. So is there a way I can maintain both? Because you're the king. If you say it, it shall be. So I said, I want to retain the baby, and I want to get the job. So he said, yes, I can have both. And he asked me the plan, what I wanted. I said, I want us to go to hospital. We'll be admitted. And after admission, she'll get healed. And now we can report to our job in Nairobi. And the president said yes. It's
This
granted.
all in a dream.
Yes, it's in a dream.
Yes.
He said yes. And so I said another problem is I had sold my clothes. So I needed 2 dresses, new dresses, to report to my new job in Nairobi. So I said, I don't have money. Can you organize for that? He said yes. And I said one more time, Mr. King, Mr. President, I need fare. Where I am, I've sold everything. I've sold my mattress, I've sold my bed, we've sold everything. So could you organize for some fare? I need money. He asked how much. I said 2,000. And he said, yes, you will have it. By the time you're reporting, I'll organize. So I said, now you can go. If I have my fare, and I have my 2 new clothes, and my baby will be admitted to hospital because they were refusing to admit us, we shall be admitted and she will be well. And then we report to the new job, you can go.
Yes.
I'm done.
Mm-hmm.
And so as he was leaving, I remembered my phone was off. And so I woke up and I started to pray. Now the father he had me in a conversation. Kumbe, when the president came now in this dream, as I ran to fall on his feet, I fell from the bed to the ground and I was talking to him. And there was a beam of light that was entering the room where we were sleeping. And the president and he was hearing our conversation. So he was like, Mama Joy, who is that? And I said, it is a president. And he said, that is not the president. That was God. I heard everything. I heard what you were saying and what you were discussing. So we woke up and we started praying. And as we were praying, I remembered we were holding hands and I put the baby on my laps and she was vomiting. And so as we were holding hands, I remembered my phone is off. I left him praying, and I ran to connect the phone, to return the battery and connect. And it was about 5:30 in the morning. And immediately I switched on the phone. My brother's phone call came in, and I answered. My husband was still praying, and I answered. I was like, hello? And she was, sis, I've been trying to reach you. And I said, what? Why? He was like, don't even ask why. Please read me your ID number. And I read my ID number, 1324, blah, blah, blah. It was like, that is you. I said, what? He said, you are in the newspaper today. And the DC called me because I had gone to cause trouble at the DC's place, looking for a job and looking for help for my children, for my baby. So he had noted my name. So when the names came, and I think all the DCs, the district commissioners, they were instructed by the head office, by Nairobi, by OP, to look for those people that were from their counties. So he had known my brother because my brother was working as a cleaner in the facility, and we bear the same John name.
Okay.
And so our name is a bit unique. So we all bear the Johnny name. So he had called him and to confirm whether that was me and to look for me. And I had now, through my ID number, I had confirmed it's me. So he said, you are in today's newspaper. Please come, the DC is waiting for you. You've been offered a job. And he explained. I picked my baby. I didn't even say amen to the prayer we were praying. I picked my baby. And those news and spread that Esther has gotten a job. She's in the papers. And I went and I was offered, to cut the long story short, I was offered, someone offered to take us to hospital. And we were taken to Chogoria Hospital. The baby was very sick. She was immediately taken to the acute. Acute is the ICU of those places. And she was admitted, and we were admitted. And I explained that after 2 days, and there were no signs of getting out of hospital quickly, I explained to the hospital facility, and I told them I explained what had happened, and I was still carrying my newspaper, and I requested to be given a letter. I come, report, not referral. They be left to the baby. They give me a letter to show that we are admitted. I go report to Nairobi and let them know that I'm in hospital. But when the baby is well, I'll go to work. So I left the baby in hospital. I went to Nairobi. I reported, and I explained, and he said, you just go. I'll note that you've reported. So in the lot that was employed then in 2007, early 2007, I'm their firstborn, those who are sent in our ministry. I reported, and he noted that I reported, and I went back to hospital, and immediately we were discharged, I came to work, and I explained to our HR director that I had a sick baby, and I gave her my story, and she referred me to a very good doctor in KNH then, Kenyatta National Hospital, and immediately we were referred to renal clinic. That means we were referred to a renal clinic. But now, to cut the long story short, when I conceived now my last born, and I was about 7 months. One day I was in the office, and I started developing some flu. And I said flu for an expectant mother is not a good sign. I'm always not used to buying drugs off the counter, over the counter. So I said we had been introduced now the NHIF, the civil servants NHIF. If I was going to get any drugs for the flu, it would be from the hospital, from the doctor. Let him prescribe even that Piriton. So I went. By the time I was getting to the hospital, I started swelling. I have the papers to show that. I had started swelling. So by the time I was getting there, the BP had shot. So the doctor said I was supposed to...
So this is the 4th pregnancy?
The 5th.
The 5th?
Yeah, it's the 5th one. Actually, the 6th one.
Okay.
That's the time I've cut a lot.
Yeah, we were at
details.
the 3rd one.
Yeah.
Now we are at
the last one now.
The 6th.
The 6th. So, and they realized that the doctor said I needed
Probably you could still mention about the 5th,
the 4th.
The 4th.
When I came to Nairobi and I was referred to the renal clinic.
Yes.
And you know now renal is about cleaning blood and
yes,
those dialysis.
Yes.
And, you know, at first you're shocked. This is a baby. And now going by the history of the losses, I was not, I was uncomfortable. But I remember I was given my first salary advance in government even before I got my personal number. Because the HR was a lady, and she identified, and you know, she put herself in my shoes, and she could not even stand in them. So she referred me to that doctor, and she gave me my first salary advance.
So that you can take care of the baby.
Yes.
Yeah.
So we went and we started the clinics. And as we were doing the clinics, I think the doctor said I needed some counseling. But then when I started, I felt if they continue talking to me, I'm going to get sick. I would rather go through it. You know, I felt I'm that type, I don't want to know what is ahead. Don't tell me there is death ahead. Let me go and find it and wrestle with it. That's the type, I think I am of a different personality. So we started the clinics, and in May 2006, 2007, sorry, the baby was now 1 year. And by October, she had started now, the blue had started to disappear. And she would now start crawling and talking a bit, and we continued, and that was by end of 2007. So in 2008, by end of 2007, I think I had conceived, but I didn't know. So in 2008, in March 2008, I was in February, I started bleeding. I had an abnormal bleeding that was uncontrollable, and I didn't know what was happening. So when I went to, after I could not even go to work, I went to hospital. So I was living in Kayore then, and the test showed I had miscarried. So I was cleaned, and was prepared and went back home. Then I took you know, the doctors didn't know what was happening, because they said from what we can see, some particles, and from the evidence we have, it's like you are expecting and you miscarried.
Like how many months were
like 4 months. Yeah, since the heavy bleeding shows it was an embryo of like it was struggling to form. There's a way they can tell. It was struggling to form, that it had, after the first trimester it's supposed to have formed, but now I was past the first trimester and the embryo had not formed well, so it just dissolved.